What's up, everybody? Sorry, I was yelling at me because my phone was turned the wrong way. So today we are going to be talking about the most common reasons to see a pelvic floor physical therapist. For those of you that don't know me, my name is Paige Hubert. I am a doctor of physical therapy, so Dr. Paige Hubert's appropriate. I don't always go by that. Sometimes it's a little too formal. But I have done significant training in the field of physical therapy. I think it's like, doctorate. So hello, school. So today you guys voted and about what you wanted to hear, what you guys wanted to learn the most. So we're going to talk about the most common things that a pelvic floor physical therapist treats and sees on a daily basis. Just so that you guys know, I have notes here to make sure that I'm giving you guys the correct information. I do have a couple of stats in here, so I just want to make sure I go into you right. So we're going to talk about the different things that we might see as a physical therapist who does treat the pelvic floor. I'm not going to be talking about the different ways to actually treat these most common diagnoses, but that's going to come in a couple later videos. Actually, we're going to do incontinence and pain and back pain and different things of that nature in other videos. Also, just kind of a caveat, this is not intended for you to diagnose yourself and then go Google the heck out of yourself, because then it's not going to end well. And just because you have the symptoms of what I'm talking about doesn't mean that the most common things you find on Google are the best ways to actually treat it. So, without further ado, what's up, Miranda? Hey, Kim. Hey, Juan, how's it going in El Paso? Jazzy, it's good to see you, dear. And Miss Heather, hi. Okay, so without further ado, we're going to get started. We're first going to talk about incontinence. I know for a lot of you guys, that's a pretty big thing. Generally speaking, up to about 50% of women actually have incontinence or experience incontinence. That's 1 out of every 2 of us, yet nobody talks about it. And on top of that, about 6.5 million men in America experience it every year. So Garrick, it's important for you too. And we often talk about it a lot of the times as relating to pregnancy. However, with incontinence, about 42% of women under the age of 45 without children experience incontinence. And then about 25% of women under 45 without children experience incontinence, and about 42% of women who participate in high-impact sports, so whether that's CrossFit or lifting, jumping, basketball, soccer, they're experiencing it as well, and just once again, nobody's talking about it. So what is incontinence? That is the involuntary leaking of urine. Most of the time, there's actually a couple different types of urinary incontinence that we're going to talk about. So the first one is stress urinary incontinence, and this is where there is an increase in abdominal pressure, which results in that leakage. So this is anything from coughing, sneezing, lifting, laughing. These are things that we all do on a daily basis that can actually occur in you having a little bit of leakage, which is no fun, and does affect your everyday life. The next type of urinary incontinence is actually urge. This one's really not nearly as common as stress is. So it's the involuntary leakage associated with a strong, sudden urge to go. I have got to go right now. Oftentimes it has some kind of a behavioral component, whether it's I just got home, I've got to go, or I hear running water, so now I have got to go. Oftentimes we teach our children to go to the bathroom with running water, but thankfully they kind of grow out of that. A common coping mechanism for urge is that you plan when you're going to go to the bathroom so that you don't have anything in your bladder to actually leak when these urges do occur, and unfortunately that's not the best coping mechanism to get rid of urge incontinence. So there are also 2 lesser known types of incontinence, and that's flatulence, so the decrease of actual gas, the loss of gas involuntarily, and then fecal incontinence, which is loss of fecal material. And just like urinary incontinence, this affects your daily life. It's no fun, and it's going to change how you're actually doing everything just regularly. So the next most common thing that we're going to talk about is actually pain. Now, pain is such a broad term, and any physical therapist is very qualified to treat pain, whether that's shoulder, neck, head, pain in my neck. Anyway, sorry, I can't crack myself up. But the common things that a pelvic floor physical therapist see are abdominal discomfort, lower back pain, hip pain, tailbone pain, which is super common. If you've fallen on your tailbone, I fell in 8th grade and have tailbone pain just because my tailbone was moved a little bit. And we're going to talk about that in another video. Just so you know, your tailbone is actually the insertion point for all of your muscles of the pelvic floor. So if your tailbone is a little bit off, it's actually going to affect how your pelvic floor is treating you and doing things correctly. We also treating people who have pain with insertion of tampons, pain with sex, pain with penetration. We even treat males who actually have pain on the shaft, and that's no fun for them. And pregnancy also tends to get looped into this. So with pregnancy, the fluctuation of hormones changes your ligament laxity and can create little ligament or joint space laxity, which can also cause pain. Also, we see a lot of women who have had previous injuries, and because of this hormone fluctuation and ligament laxity, they're getting pain from these old injuries that they haven't had in a really long time. We do see that a lot. Some of the next things we treat is pregnancy and postpartum, and that's a good portion of our clientele for a pretty good reason. What's up, Sam? Heather, feel free to message me whenever I'm free. What's up, Taylor? Garrick, I'm still impressed that you are still watching. Oftentimes women need assistance during pregnancy because as the baby is growing, there's more weight coming to the front of the body, creating really poor body mechanics. Heather wants to know, why don't we have a primary care refer to men instead of urology? Oftentimes they don't know that we can treat this. It does tend to be something that's like, red flags, help me. It's a pretty big area for them, and it tends to be an issue. So they do tend to get sent to urology. They can get urologists do tend to refer to a physical therapist for this. It's just a little bit less common, and once again, not really talked about because men don't want to talk about pain in that area. Anyway, back to pregnancy. So with the increase of weight from baby in the front, we tend to have really poor posture, which creates muscle imbalances and weakness. So oftentimes we need to treat them to re-strengthen and to get good posture so that they are kind of working out of that pain. It's really important to train women how to labor appropriately. So that's coordinating muscles appropriately, even when you can't feel them. And that does come from a lot of strengthening and a lot of discussion and education. And then we call this now the fourth kind of trimester after you have a baby. Oftentimes women have a really hard time coordinating that pelvic floor and getting those muscles to start firing again, just because birth is trauma for your pelvic floor, especially if you have a vaginal delivery. So oftentimes women need our help to relearn how to use that musculature. So the last topic that we're going to talk about today is pelvic floor prolapse, and not many people even know what that is. Hey Chelsea, so we're going to go over it really fast. It's where the organs of your pelvis actually start to descend toward or through the vaginal opening. It sounds terrible, and I can guarantee you it's no fun, and it causes pain. And this occurs because there's a loss of support from the pelvic floor muscles, the ligaments, and the fascia in the actual pelvis area. Anything that increases pressure in the abdomen can start to cause this. Hey Taylor. So generally we see this with pregnant women or women that have recently had a baby and it was a larger baby, just because it does increase that pressure and kind of push things down. Common symptoms that we have with this are incontinence. A lot of the times our women are working through incontinence and doing the different things that we teach to get rid of incontinence, and it's just not working, whether they're Kegling and they're really strong, and it's just because that there is a prolapse pushing the bladder down a little bit. We also see a lot of times we get complaints that women feel like they're falling out of their vagina, and that sounds awful, and I can't even imagine, but that is oftentimes what we get as a complaint. We also get that there's a lot of heaviness in this area. There's actually vaginal flatulence in this area, and then they can also have a lack of sensation during penetration, and then also lower back pain. So if you have any of those things and you're worried about this, feel free, message me, comment on here, let me know. I'd love to discuss this with you further, because like I said, it just does not sound fun. You do need a pelvic floor exam to get actually diagnosed with this. So that's either through your gynecologist or pelvic floor physical therapist. There are several different types of pelvic organ prolapse, and they vary in severity. So that's why you need the exam, so that we can figure out what's going on and how it's best to treat it. What's up, Andrea? So like I said, some of the most common things are incontinence. So there's stress, urge, flatulal and fecal. There's pain, there's pelvic organ prolapse, and pregnancy and postpartum are some of just the most common things that we do see as pelvic floor physical therapists. Now, like I said earlier, please don't use this as the gospel and go Google it and use this as your diagnosis, because there's probably other things that are occurring that I'd like to take into account before we're just like, oh, all of a sudden you have X, Y, or Z. So like I said, feel free to comment, feel free to message me so that we can talk about what's really going on with you. So those are the most common things that we see. If you have any questions, like I said, reach out. If you need anything else, let me know. Talk to you guys next week. I think we're probably going to do incontinence, but we'll see what you guys want to learn about. Talk to you later. Bye.